Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet. Look what I did already.
Oh, Bob. In our opinion, of course.
Okay, Brad, today, let me, do a little housekeeping here. Today we're going to talk about this one simple exercise that can help your tennis elbow. And this is, science says this, by the way.
Science says it. I'd like to meet science.
Yeah, we're Mr. Science, Mr. and Mr. Science.
Actually, we do have a nice study right here.
Yeah, we do. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us because Brad and I, it's such a sad tale. We cry just about every time we talk about it. We were not like this children, and we're trying to turn things around.
Right, and it's working.
All right, the study.
Okay.
And this is not the first one of this, Brad, but they're finding out a lot of times now that eccentric strengthening is going to help you heal tendons, especially like patellar tendon, they're finding out. Pretty much anywhere you have a tendon. And when you have lateral epicondylitis, tennis elbow, there's a tendon that's giving you trouble here.
Sure.
And it's on the outside of your elbow, and you don't have to be a tennis player. Any gripping type of activity can often bring it on. But this is a study that, followed up on that and worked on was talking about this device here.
Sure.
So I'm going to give you the title just so you have it, but this is something only a therapist could love because it's
Go ahead.
addition of isolated wrist extensor eccentric exercise to standard treatment for chronic lateral epicondylitis, a prospective randomized trial. And we got a bunch of MDs and PhDs and
a lot of smart people. They're way up there in
smarter than we are,
the cerebral area. But what are they talking about? They want to strengthen your elbow, the muscles in your elbow, in such a way that they get stronger without being irritated. And you mentioned the eccentric.
Yeah.
So some people may not say, well, eccentric, what is he talking about? What do we mean?
So with concentric, the muscle is shortening and you're strengthening it. So that's normal lifting. So like if I'm going to strengthen the bicep, I'm going to lift up like this, right? If I want to strengthen the bicep eccentrically, I would start off with a weight up here and lower it down.
Right.
But something else would have to lift it up then for me.
Right.
Because I don't want to do it concentrically. So I would lower it down like this, and I'm strengthening it while it's lengthening.
Right.
So we got to strengthen this muscle while it's lengthening, which is kind of difficult to do. And this is kind of an ingenious way of doing it. This is the can-do twist and, what is it? Let's get it right here, Brad. Twist and bend bar.
Right. It's not really a bar. They're rubber tubing. It's excellent. I'm really thoroughly impressed on how these work and how well the resistance works with the wrist.
Yeah, and these are, by the way, made out of latex. So if you are allergic to latex, you probably can't use these.
Sure.
I mean, or you have to wear gloves or something.
Right.
You'd have to do something. We're going along the resistance line all the way from this is the least amount of resistance, and works all the way up as the color gets darker to the most. And this is a real bear to use on that one.
Right, you've got some really good beefy. You're strong like bull if you can use the black one. Big Popeye wrists.
I was surprised. I saw some semi-negative reviews about that they didn't feel like the tension lined up with the colors, but I don't see it, Brad. I mean, I went all the way through, and it gets harder and harder as each color. So I thought for the price, it was a really excellent product.
Right.
So
are we done?
Yeah. All right.
Oh,
so
we got to show them the exercise.
We're going to show the exercise.
People are probably wondering, how do you exercise with this rubbery tube thing?
What I would recommend, and Brad, you thought the same, is you'd probably, especially if you're having trouble with a chronic problem where you're having, is that you'd probably start off with this one.
The lightest color, yes. Right.
And according to the study, what they did, I'm going to grab the study again because it tells on here. So let me set the stage for the study. They took people that were on physical therapy already.
For tennis elbow.
So you're going to want to, you can do physical therapy along with this, but all they added is strengthening to the therapy. Now, they might have getting an ultrasound or they might have been doing cross fiber massage. We'll show that after this.
Sure.
But in addition to that, they did 3 sets of 15 of these.
Sure.
They did it every day. They had a 30-second rest between each set, and they did it for 6 weeks. 6 to 8 weeks, I'm sorry.
People are just dying to know what these are.
Yeah. But the thing is, though, there was a significant improvement on the people that did this versus people who did regular strengthening.
Okay.
I mean, their pain levels were a lot less, and their strength was a lot better.
Okay.
So it really is worthwhile doing this one exercise.
Okay.
So very simply, what we're going to do, Let's show how to strengthen the left one first.
Right.
Do you want to do the side view, Brad? Or
Sure, I'll do this. So the strap on here represents my sore elbow, the one with tennis elbow.
I'm doing a little bit different than they did it because I think it's easier. I want you to put your hands on top of the bar, elbows into the side, Brad, to the side of your body.
Yep.
Well, they're not to the side of the body. I suppose you're trying to show it, huh?
Right,
Like this is the side of the body.
Oh, like this. Yeah,
Yeah.
I want them to so people can see it.
Right. So I'm strengthening this one. So you're actually going to twist forward with the right one.
So these aren't really bars; they're rubbery, elastic things, and they twist really nice. That's why there's ribs on them, so you get good grip. So
Twist
go
forward
like
with the right one, and now I'm going to count to 4. 1, 2, 3, 4.
And let that one go.
And that one was strengthening the whole time while I was doing it.
Okay.
Now I'm going to release on both sides and reset. And then I'm going to do it again. Twist, 1, 2, 3, 4. Release, release.
Oh, Bob, your clipboard.
Yeah. Twist, 1, 2, 3, 4.
Good thing that
Release,
never happens.
release, twist, 1, 2, 3, 4.
So this is the eccentric part of it because we're going this way and we're going this is the eccentric strengthening. We're not going back and forth. That's why we let go. We twist, eccentrically strengthen the muscle and then let go and go back to the starting point.
I don't know you bad, but I can feel it.
Oh, yeah.
And I don't feel anything in this one because this one's doing the twisting.
Right.
1, 2, 3, 4. I'm using the red one now. All right, let's say we want to do the right hand, Brad.
Sure.
So now we're going to go opposite. Again, both hands on top. And I'm going to twist with the right one now, or the left one now, and then this one's 1, 2, 3, 4. So I'm going to grab underneath, twist, 1, 2, 3, 4. Reset, put them on top, twist it, 1, 2, 3, 4.
I'm getting tired, Bob.
I know. It looks very subtle, but it does work. So again, you'd start off, I would recommend probably with this one.
Yeah.
Some people, like you said, this is about what you'd use for yourself right now without a problem.
Right, yep. I'm getting a good fatigue with that.
These are getting beefy, and we'll put a link down below on how to purchase these. Now, in addition to this, I'm going to recommend that you might try some of the things that we would recommend for physical therapy. And one is what we talk about cross-fiber massage.
Sure.
So what we do...
I really feel like hitting you with this, Bob.
Yeah,
so don't do that at home.
You could really knock somebody around with that
Wow.
thing. So for cross-fiber massage, so in addition to do the strengthening, so you have the lateral epicondyle right here, and coming right off of it, you have the extensor wad of muscles here. You can actually massage these muscles too,
Sure.
because they often are tight.
And if they get tight, they're putting stress on the sore tendon.
Right. In addition to that, you actually can take your fingers, come off the bone here, and rub right around in this area here.
And you see the direction he's going. The muscle fibers go this way. He's going across. That's why it's called a cross friction.
You can find the tender spot and work on this. And this is a very common way to treat tennis elbow. What you're looking for, by the way, is that as you start to rub, after maybe 30 seconds or so, it levels out. The pain isn't getting worse and worse. And in fact, it might even feel better.
Right. Yep.
If it just keeps getting worse and worse,
then stop.
Yeah, you got to stop. You're not ready for this. You may have to do the icing instead.
Right. Give it more time.
Get it more time. Maybe start the eccentric strengthening.
Sure.
If you can tolerate it. But what you're doing is breaking up scar tissue, because a lot of times as tennis elbow develops over time, it develops scar tissue, and it'll feel better. And then all of a sudden you'll play tennis or whatever, or do a gripping exercise, and it breaks loose again.
Right.
So we're trying to, cross fiber helps realign the fibers so that they become strong again. Now you can go ahead and do this for, I'd say maybe 4 to 5 minutes. You can do it a couple times a day if you want.
Yep. Your fingers, when your fingers get sore from rubbing because of the pressure, you had enough. That's kind of the rule I use. That's usually about a few minutes.
I would also do the extensor stretch, Brad. So maybe just go ahead and bend the wrist down and turn it out like this.
Yep.
So this is a good stretch to do.
It's not a real aggressive stretch, but if you've got tennis elbow, a sore tendon, you'll feel it quite a bit more than if you don't, on one hand to the other.
I'm also going to show you one other thing, Brad. Sometimes if you look at both of your elbows and one of them doesn't straighten out as much,
Sure.
that can be what they call pseudo tennis elbow, false tennis elbow. you're still having pain in this area, but it's really more of a joint issue.
Okay.
And there's one stretch that works out pretty good for that. You're going to find a table like this. I'm looking at this is the one I'm having trouble with. I put my fingers down so they're facing me.
Yep.
And I'm actually going to take my hand right below the crook of my hand here, and right below the elbow, and I'm going to push it that way. While I'm
away
leaning
from
on it.
you.
Yep, while I'm putting a little weight on it, I'm going to put 1, 2, 3, 4, 5. You know, pressure on, pressure off.
And should that feel
Pressure
good
on,
or
pressure off.
painful?
It should feel good. If it doesn't feel good, don't do it.
So it should feel
Yeah.
like good pressure.
I'm going to show this direction.
Yep,
so
that's
here
a
I'm,
good
I'm right
idea.
here. I'm again grabbing below the elbow here. Pressure on, pressure off. And you can do it 10 times. Pressure on, pressure off. Yeah, I'm going in this direction
Towards
here.
me. So, but you're not, are you putting a lot of pressure down or just enough to hold
Just
it?
enough to hold it.
Okay.
Yeah, exactly, Brad. That's precisely.
Precisely.
My tie's in the way here.
Yeah. Well, there you
There you
go.
go, yeah.
I got the scissors back there.
Yeah, that would have worked too, but pressure on, pressure off. It's surprising how often that'll work too. The final thing we're going to give a mention to, we just got sent these braces, and Brad and I are going to give them a try.
I've got one right here.
What are they called? They're called the tendon track. And it's an interesting concept that we're
There's
going
a
to,
little box.
yeah,
Kind
that
of
we're
a
going to
cute
use. So like most of these braces actually put pressure right on the tendon to try to take some stress off where it attaches to the bone. This has two little, what would you call those,
Pressure
Brad?
pads.
Pressure pads that go on each side of the tendon. So you look at the redness here. That's what it represents the tendon and the
Right.
muscle.
The sore muscle and tendon area. So I put one on each side, and then I'm going to take this and tighten down. And this is elastic with Velcro, and it puts pressure in the two adjacent to it as opposed
Right.
to on top, which a lot of the ones are. So it's another approach, and that's what we got to find out if it's going to be helpful.
And they actually can use this for Achilles tendon and also patellar tendonitis.
Right.
We're going to give this a try and see if it works. I like how well it snugs up.
Yep.
What I didn't like is, I mean, it almost needed two people to set it up, didn't it?
Right, because you have to adjust these pads.
Although you ended up doing it yourself, right?
Oh, yeah.
And
Yeah,
I did
I'm-
mine myself, but I mean,
yeah.
it's just a little clumsy to start off with.
Highly talented individual, Bob.
And he's highly humble, too.
Yeah.
All right.
Can we go home now?
Yeah, thanks for watching.